I'd like to welcome the next group of patients and presenters. We're going to move on to our first main plenary, which is patient experience through the continuum of care. So I'd like you to sort of envision patient flowing through our system. We start off maybe with pediatric patients, and then they age and they come into the adult system, and the other parallel might be a diagnosis, living with chronic kidney disease, and then progressing on to dialysis and a transplant. So we've tried to sort of mirror this progression in this series of presentations. I'm going to I'm going to mention the names, and then what we're going to do, just because there's a lot of people we want to hear from in a 1-hour session, I'll mention all the names here, and then people are going to come up in turn and do their presentations. And I'm going to ask if you can save your questions until the end. We've got 15 minutes at the end for a lot of hopefully nice dialogue. So the first speaker is going to be Helen Chiu, who's the quality lead of patient-centered performance improvement at BC Renal. And after we hear from Helen, we'll hear from Leilani and Dave Kerr, who are the parents of 2 boys. And their eldest son, Theo, who was born in October 2013 at Children's Hospital, has bilateral kidney dysplasia and chronic kidney disease. Our third presenter is Colin Shaw, and Colin started hemodialysis in Kingston, Ontario in 1976. He was 14 years old at the time. He had 2 failed transplants in 1976 at 6 weeks, and a second in 1978. He's husband and father. He's done conventional hemo and nocturnal, and he was actually the first nocturnal dialysis patient at Toronto General in 1999, so he's got a lot of experience to share. And last, we'll be hearing from Tuason, and he's a recipient of a kidney transplant in 2018. He's an active community participant. He's a passionate volunteer. He's a staunch advocate for the vulnerable and people with varying challenges and abilities, residents in long-term care with life-altering issues, and isolated seniors and youth alike. So I think if we can just have people come up onto the stage and transition through, and again, save your questions until the end, please. So Helen.
Thank you, Alex, for the beautiful welcome and teaching, and thank you, Caroline and the Planning Committee, for the opportunity to speak with you about measuring kidney care experience in BC. In particular, I'm going to talk about why and how we did it, and also where we are currently in terms of partnering with patients, families, and health professionals, enhancing patient experience. So for those of you who are familiar with the What Matters to You campaign, you would have heard of the tagline, ask what matters, listen to what matters, and do what matters. So this is essentially an example of asking, listening, and doing what matters at the system level. Why do we want to measure patient experience? Patient experience is a unique and important aspect of healthcare quality, and it helps us look at quality of care through the eyes of the patient. It's a way to help us be more accountable to the care that we provide, and it's also help us to gather feedback on what we could do better in person-centered care. Essentially, it's help us focus what we do on what matters most to the patient and community whom we are serving. So there are thousands of patients who are receiving various types of kidney care in BC. How do we effectively measure all these experiences of all these individuals? To get a glimpse of that, we used a survey called the Patient Assessment of Chronic Illness Care. We chose this survey because it's a validated tool that helps us measure aspects of chronic care delivery from the perspective of the patients. There are 20 questions in the survey that can be grouped into 5 main areas, and they looked at patient interaction with health professionals, emphasizing self-management support based on the chronic care model. And it's quite interesting because it assumes that the healthcare system and the community support actually wraps around the patient, which is what it should be. However, we know that still a lot more work to be done. So this survey is actually a tool that can potentially identify a lot of room for improvement. We have conducted this survey for 3 times now in the past decade, and then the last one in 2016, we asked all the patients who were actively receiving any type of kidney care at that time, the same set of questions with the survey. Although the responses are anonymous, we were able to code them so then we can analyze the result by different types of kidney care, by health authority and facility. All the provincial reports now are up on our BC Renal website, and you may also get a copy of the regional report from your program leaders. And having said that, the value of the measurements is actually not just from measuring alone, but also from how we actually make use of what we have measured. So this time around, we took the time to generate reports that are hopefully more meaningful and useful for guiding improvement. And we are also taking the time with the follow-up in terms of communicating the result provincially, and also follow up with the planning for action in response to the result. From the latest survey result, we know that we have been doing great in a number of areas according to the survey, so congratulations to everyone. And most of the patients actually rated the overall quality of services as excellent or very good. However, there's always room for improvement, but to be realistic, we need to strategically target our improvement effort where it will give us the biggest bang for the buck. To do that, we use the priority matrix methodology to help us highlight the survey questions that has the greater potential for improvement, as shown in the upper left section of the matrices, as you can see on the slide, without going into too much of the details. And when we look at various matrices by modality as well across all renal programs, there are 2 questions consistently show up as the top priorities. And these are questions that are part of the patient goal setting category. Having said that, the patient goal setting is a really broad topic. Besides, there is so much more to a person's experience than what it can be captured with a multiple choice survey. So the survey essentially is the tools that indicate where we need to have further conversation about what and how we need to improve on regarding the topic. For the conversations to take place, we organized a series of focus groups collaboratively with the renal program to further understand what goal setting is and to figure out what goal setting would look like when it works well. Through this discussion, we were able to gather input from our patient, family, as well as frontline clinicians as they listen and learn from each other's perspective and stories at the same time. So far, we have actually completed 7 focus groups in all the health authorities. So right now, we are in the middle of transcribing and analyzing what we have heard. So hopefully, we can bring it all together in a provincial workshop where we could collaboratively plan for and agree on what we could do together to improve on patient goal setting. Then we could follow up with the change and hopefully verify the progress at our next round of surveys. So hopefully this overview help illustrate how we could systematically find out what matters so that we can act on what matters most with our patient, family, and health professional. The process itself, just embracing that is as a culture shift for better person-centered care, and is just truly rooted in partnership with the patients, the family, and health professionals. On that note, I would like to thank all the patients and family who contribute your voices through the surveys and the focus groups. And I would also like to thank all the program leaders, manager, health professional, Kidney Foundation, and BC Renal team for making the work possible. Thank you. Enjoy the conference.
So if we can welcome up, please, Leilani and Dave Kerr.
All right. I think I'll have to start off by saying that as the parent of a 5-year-old who's almost a 6-year-old, seeing everybody here who's working towards making making his life better now and in the future is incredibly humbling. I'll try not to get emotional right away, but it's too late. Just to introduce you to Theo. So Theo's our son. He was born on October 21st, 2013, so he's just about to turn 6. He was born at Children's Hospital. We discovered during an ultrasound pretty early on in my pregnancy that he had hydronephrosis. We weren't sure how bad or what it was going to look like, but obviously it was kept a close eye on. As the pregnancy progressed, it became pretty clear that it was much more serious than we had perhaps first anticipated. He had one non-functioning kidney, and the other one had severe hydronephrosis, so the prognosis was not encouraging, to say the least. I lost my amniotic fluid at 28 weeks, and he was eventually born by C-section. It was planned, of course, and he had a whole team waiting for him in the delivery room. When he was born, he was whisked immediately away to NICU. That was expected. No appetite, so he was fitted quite quickly with a G-tube. It was also determined that he could not urinate through his ureter, so he was also quickly given an operation to have a pilostomy, so he now urinates through a hole in his side. He came home after 6 weeks, near December, so that was our Christmas present. I can see some of these pictures are here. This is during his 6 weeks. It was a tough time, but he was very well cared for. Excuse me. So as I think you'll see as these photos progress, thanks to the care that he has received at Children's, he is now a thriving almost 6-year-old. He's in grade 1. He still has his G-tube, he still has his pilostomy, but he's kind, he's bright, he's a funny kid, and he's participating in as much of a 6-year-old's life as I think we could hope for. So his single kidney is still trucking along. I think it's defied expectations. We expected that he would be on dialysis within his first year, but he's, like I said, almost 6, and it's still going. We anticipate that he will need a transplant at some point. The exact timeline is unknown, but we'll see how it goes. So we were asked to talk about his kidney care and what matters to us most.
Yeah, I think above all, we just wanted to do everything to keep him healthy and thriving, and just keeping the big picture in mind for his quality of life, and that he was going to be a happy and thriving young boy.
Yeah. And so we were asked, what has his team done well? That was extremely easy to answer because the answer is so much. He's obviously too young to assume responsibility for his own care, but as parents, the team at Children's has given us all the tools that we need to keep him as healthy as possible. We just came back from a visit, Dr. Dion, not too long ago, so we visit about 2 or 3 times a year. they always explain to us, we do the blood work, they explain what the impact of the blood work is, how it's doing, how he's comparing to previous checkups. And if it's changed, they explain the implications of those change and how we might deal with it in the future. So we definitely feel that we've been drawn in and kept very involved in understanding of what is going on. We're not just passive participants. I think we can also say that obviously some of this is trial and error. We thought he'd be on dialysis and he's not, so whenever a change happens.
And just to be clear, we thought, and everyone thought he would be possibly on dialysis at maybe even 4 months of age. It still hasn't happened. He's almost 6.
And that, I think, is in large part due to his team. So, yeah, he's closely monitored, and any changes, I think, are done in consideration of all aspects of his condition. And as his parents, if we have questions, and we always do, we always feel that they are wholly answered, and if the answers aren't known, then they get investigated, so that means a lot to us. So there's some improvements, I suppose, that we could talk about, but there's not much.
Some of it, I guess, is more administrative. Just looking at, he's been poked and jabbed a lot ever since he was born, so he's definitely got what we call like a white coat syndrome, where he sees somebody in a white coat and is stressed because he gets blood tests, a lot of blood tests, and so I think we had attempted to book a GFR, and there was a couple tests we were trying to book at the same day, so we didn't have to come back to the hospital on 2 different days, and it just so happened that 2 of the tests were mistakenly booked on the exact same time, and we obviously couldn't be in 2 locations at the same time. So, but we really had to struggle to come up with some ways that the care could be improved.
And so the last question that we were asked is what person-centered care would look like for us. And as I think it's probably abundantly clear, I think we have it. Our care at Children's, it's all-encompassing. He's got a very specific and rather unusual issue. But when we receive care for Theo, it's for the whole kid. In the early days, we had no idea what we were doing. We're in NICU. There were social workers there to help us deal with insurance issues. There was people arranging to have his medicine delivered to our door when he came home. As he's grown up, there's been different needs that he's had. There have been arrangements to help him with the BC Centre for Abilities. And none of these are necessarily directly kidney related, but they've all helped him grow into the kid that he is today. I realize we're running out of time, so this is where I get emotional again. But we could not be more grateful for the care that he's had. Dr. Dion, his team at Children's, we never expected him to be like this and doing this well, so thank you for that.
Very, very moving words. And we're going to continue on with the patient voyage with welcoming Mr. Colin Shaw to share some of his experiences.
No, oh, sorry. No slides.
Just feel free to stay and have a seat here with us.
Okay, thank you. Hi, my name's Colin Shaw. I've been doing hemodialysis for 44 years. It's kind of a dubious thing, but it proves one thing: I survived it. I should say my wife and I survived it, my parents and sister before that. Not only survived it, but thrived it. Details of what happened to me getting here are somewhat important, but how I got here might be more useful to you guys today. Briefly about me, I grew up in Kingston, Ontario. As a kid, I did all the boy things. I played hockey, soccer, tennis, swimming. I rode my bike everywhere. I never sat down. Just after Christmas in 1975, I was tired. My mom took me to the doctor. Protein in my urine, diagnosis of glomerulonephritis in May, and I started dialysis 11 months later at 14 years old. The kidney transplant in 1976, August, worked for 6 weeks, and February 1978, worked for no weeks. I finished high school in 1980, and I graduated U of T Engineering School in 1986. I married Julie in 1988. I had a son, Liam, in 97, and worked 30 years in the aircraft industry, and retired to Kelowna from Mississauga, Ontario in July 2018. I'm currently still doing nocturnal hemodialysis. I'm on the highly sensitized transplant list at St. Paul's. Sorry, I got the second page. One of the things I wanted to do through the course of my illness is keep my life as normal as possible. And when I was with my parents, that meant home dialysis. It was a very insightful decision my parents made. School every day if possible, tutors during hospital stays, and a focus on doing well because, as my dad said, physical job might not be a good thing for you. As a young adult, that meant university success, social life, sports. As a young married couple, career or home building and travel. Later, raising our son and enjoying family life. So to live life like this required staying as healthy as possible, and that meant a number of things. Staying physically active. Being strong is huge. Being compliant, mostly. Psychological health is important too, really. 44 years without bacon. But most importantly, we had to actively manage the illness. So when I just left home for university, I came back to residence one night after dialysis to find a party in full swing. Among the drunk frosh was a first-year med student in underwear and running shoes running around the house with a cape around his neck like Batman. A couple of years later, he arrived in a lab coat and stethoscope in the dialysis unit for rounds. Guess what was in my mind? I tell the story because it and some other things brought home an important point to me, that medical professionals are first human, and secondly, just have a different skill set than I do. So I got lucky. My wife, Julie, was a hemo nurse at Toronto General when I met her and went on to do 32 years teaching home peritoneal dialysis at Credit Valley in Mississauga. And my nephrologist understood my need to live my life fully and was willing to listen and actively take my opinion into account when he was making decisions about my health. Prescribed Sensipar for me at my wife's urging, and no parathyroidectomy in 44 years. And when we approached about nocturnal hemodialysis, he started a program and I became the first patient at Toronto General. He allowed me to become a partner in my care, and over 30 years we made a good team. He empowered us, and this enabled us to control our path as much as possible. I'm sorry. So while my nurses in the home dialysis unit went above and beyond by dealing with my issues in the unit, not sending me to emergency, teaching me to take IV antibiotics at home, or helped in organizing treatment in our favorite vacation spots. The vascular management team contributed on numerous occasions, revising my access, saving me from bleeding to death on 3 occasions, and scheduling balloonings of narrowings in my access. This continues in Kelowna, where my doctor fast-tracked my participation in the study of a new dialyzer. My nurse helped us quickly transition back to home dialysis after our move. Their foresight and proactiveness greatly contributed to the fullness of my life, cannot be overstated. So kidney failure takes a lot of control from the people who suffer it and their families. It's easy to resign to a feeling that one's life is over, or to retire to the couch until a transplant is received. But there's no cure for kidney disease. It is a life sentence. For patients, despite the burden of dialysis, I say stay fit, stay informed, be confident in your discussions with your healthcare team, and insist they hear you. Don't be afraid to live your life. You only get one. Don't put it on hold. For the healthcare professional, I ask you to see your patients as people first. They aren't different people than they were before. They just have dialysis now. There's a lot of fear associated with dialysis. Empower them by helping them overcome their fear of the process. Make participation in their care expected. Consider patients who choose peritoneal dialysis. They are required to learn to take control of their treatment with the goal of sending them home, no choice. There's a lot of time during hemo treatments, put it to good use. Involve them depending on ability. Teach them to take their own blood pressure, the importance of their dry weight and the needle pressures as an indication of access health. Recording their vitals and doing hourly checks. These small things are the first steps in helping patients gain some control of the process and regain confidence to take back their lives. Dialysis theory for more capable people, all the way to teaching self-cannulation as a springboard to home hemodialysis. And if you're doing home hemo, then it should be nocturnal, full stop. Think of the expectation on peritoneal dialysis patients versus hemodialysis patients. If you, Nurse X or Dr. Y, were diagnosed with kidney failure today, what path would you choose to have your life follow? I challenge you to help your patients follow the life of their path, follow the path of their lives beyond their medical needs. They need someone to help them get strong again. This needs to be your job too. Thank you.
And here's Matt making his way up. Look forward to hearing from you too.
This morning, I sit in front of you, all because of the miracle you do. Thank you for this opportunity to be with you, especially to our benefactors and donors, their families and circle, a heartfelt and lifelong gratitude to each one of you. My chronic kidney disease journey started with denial, confusion, ignorance, fear, hopelessness. So lost to a point feeling defeated, close to throwing in the towel. I recall the day when I was diagnosed with end-stage renal disease, then introduced to the renal care team, where my education, enrollment on the transplant list, and dialysis care commenced. Those days, rather years in dialysis, tested the limits of my being. Before the cock crowed, I was up by 4:30 a.m., ready for my handy-dart ride, lucky to be back home by 6:30 p.m. So exhausted, straight to bed for the day, just to rest and get enough energy, only to do it all over again. Denied the most biological and natural pleasures of life, I felt there was really no living during those dialysis years. My dialysis presented my care team with several challenges, from my acquired complex status to personal issues. Undeterred, my renal dialysis team confidently fulfilled my treatment, care, education, and encouragement. Beyond family and friends, I found in them the true meaning of professionalism, community, family, friend, and TLC. Question: what was my care team done well in helping me manage my care? My family and I endured this dreadful end-of-life kidney disease. However, with your supportive teams, from the office staff, social workers, to your maintenance crew, equipment, devices, and laboratory technicians, dietitians, pharmacy team, to our renal team, the nurses, residents, doctors, medical specialists, to our peri-operative team, surgeons, nursing professionals, you made living a manageable quality of life. Through the support and education advice you provide and the care I receive from you, I am able to resume the community and advocacy work that means so much to me. For an added bonus, I get a few more quality years with my family, especially my grandchildren, future of humankind, all of which an impossibility without my transplant. What does a person-centered care look like for me? Through my interactions with every team member, I felt that I was heard. No question was too dumb. I never received an answer that made me feel dumb. If there was a goal I wanted to accomplish, the doctors and the team helped me find a way to get it done. Question was, how might my kidney transplant care experience be improved? My dialysis has presented several challenges. Although trustingly we went through my care, there were moments of uncertainty, worsened with the unknowns, which of course my journey leads me, how it impacts my family and circle. Knowledge is a great tool. An enhanced rehabilitation plan incorporated with the standing continuum of care, a shortened wait period for a transplant, and a reliable transportation surely is a welcome add-on. What matters most to me regarding my kidney transplant care? The work you do for organ recipients and organ donors alike helps hopes and dreams and salvation to be realized. It is where life is rebooted and a promising future can continue. Living life more meaningful and more deliberate is the personal impact to being blessed with a transplant. Every moment more precious, every kind gesture I am fulfilled. Every challenge reminds me that yes, I am alive. What matters to me most during the care I have received? Through all the advancement in science and the technical complexities, it's the humanity conveyed by all of my team members. I was just not a number. Never were any of my goals and desires, no matter how lofty or small, ever dismissed. What's the impact to me personally of living with a transplant? As you can see from the slide deck running behind me, the impact to me personally of living with a transplant is I'm doing all I can to live this gifted life to the fullest and savoring wholly the love of family, all that I can. A chance to pay back to mankind, dedicating my service as a volunteer and ambassador to Transplant BC. To summarize is, with your compassion and expertise, your patients, us, gets a chance to continue living this miracle of life. On behalf of my fellow organ recipients, our family, our circle, and donors alike, we thank you.
I'm sure I'm as moved as everyone in the room with the generosity of spirit with the emotion, the knowledge, the expertise, everything you have brought. Thank you for sharing your perspectives. I feel very humbled. And I think we can all just stand here for our guests and give them a warm thank you for their contribution. It's hugely helpful to hear these stories, and I think you've all been very kind in saying things that we've done right. We're really open to hearing otherwise. I want to just remind everyone that this year we're not showing the questions for the live polling in the app. We chose not to do that, but you'll see it on your screen. I thought the questions would be pouring in by now, and I think they should be pouring in. Again, please come to the mic if you want to ask a question, but I get to take my prerogative to ask. And in the spirit of keeping this kind of conversational, I'm going to sit down to do so. My first question was to Leilani and Dave, and that was, it struck me how early you found out about this impending problem of kidney disease. And did you receive any help in the prenatal stage, at the early diagnosis stage?
Yes. It was one of the first ultrasounds that, I guess there was some pre-screener blood tests that we had that we were referred to Women's Hospital to do the ultrasound there, and the kidney overinflation, I guess, or the nephrosis was very, very clear from the beginning. And we were referred to Dr. Dion, which we've known since before Theo was born, probably around 20 weeks-ish. Yeah.
So you met the nephrologist before? Oh, that's interesting. Any other questions? I had an important question for my everyday care, actually. I try to be one of our champions of home hemodialysis, so I love hearing about your vigor and dedication to this, Colin. And a common thing that we come up with is some resistance to something that's new and unknown, taking this home. I can't possibly do this. So I really appreciated your comment about make this essential. You know, do nocturnal if you're going to do home dialysis, but maybe you can give us some advice. How hard do we push? Because I'm worried sometimes we push people away or we alienate them and they dig their heels in, they don't want anything to do with this. What do you think about that?
Well, I mean, when I was doing dialysis at the beginning, and I was leaving home to go to school in Toronto, went in for dialysis one day, and they just said, okay, you're putting your needles in. And it was like, okay, I wandered around for 15 minutes, and I sat down and I did it, because I knew I was going to have to do that when I went away. So the main thing for me is that I did conventional treatment for 20 years. And by the end of that course, I was in pretty bad shape. I couldn't mow the lawn. I'd do 1 or 2 strokes of the lawn, have to sit down. I was breathing heavily. I had a lot of trouble with calcification in my vessels and things like that. And nocturnal hemodialysis was, and I also had a serious trouble with itching and restlessness. And I was trying to work, and I was having trouble sleeping, and I would be up half the night. I was scratching my arms, bleeding, and that kind of thing. The nocturnal hemodialysis took that away in 3 days, and reversed the majority of the calcification in my blood vessels, and I was able to go back and start playing hockey again and stuff like that. So that's why I stress that. I don't think that if you're going to do a home dialysis, you've got to set the machine up, you've got to put yourself on, you've got to take yourself off. You might as well be doing it overnight while you're sleeping and getting 8 hours of treatment instead of 4. And doing it 4 nights a week or 5 nights a week, and you're getting 40 hours of treatment instead of 12. And so the health benefits are huge for that, and I don't think pushing people away, I don't understand why that would be the case. You're so much healthier doing it at home. You're not in the environment, which can be sometimes kind of depressing. you're able to control your schedule. You're not at the mercy of, well, can I come in Saturday afternoon instead of Saturday night because I have something to do? No, you can't, sorry. There's been a huge amount of advantages for me to be at home, and I've been at home the majority of my treatment, I guess. 30 years with my wife, Julie, and I don't really know any other way. If I have to go to a unit, I find it difficult.
Was there a time that you felt pressured to take the next step, the day of the needles? Do you remember?
Well, it's not, because my parents made the decision at the beginning. And they were putting needles in for me and that kind of thing. Then I was 14 years old or 15, and it's like, okay, that's what we're going to do. So it wasn't an adult making that decision for myself, so I guess it's difficult for me to speak to that. It was just kind of something we always did. And transitioning back, so there was a period between the time I left home and the time we got married and moved into the house that we could do home dialysis again. And my wife, as I said, she'd been a hemo nurse, so no problem for her either. So we just said, yeah, that's what we're gonna do.
Very handy person.
So there was no stepping stone for me. It was just kind of done that before, okay, I'm gonna do it again,
That's very fortunate. It was a smooth transition for you. Happy to see a few other questions coming in here. We have one for, well, I can open this up, but there was a question here about transitioning in care for Bet and for Colin. You've transferred between different modalities. How did your transition care from one team to another go? That's a good question. Was there any introduction that you may have had with the transition? Did it feel clunky? Maybe you can fill us in. Start with you, Bet.
In my case, things happen so fast that the continuing education part was like when it was handed over to my dialysis team, that they carried on the task. Although I would have wanted a little bit more intense or more input from it, but things happen so fast for me.
Any thoughts from anyone
else? I think we were in the hospital with Theo since he was born for about 2 months, and I know Leilani and I were kind of chomping at the bit to get him home, and so we were definitely pushing, train us, show us how to do everything, and we want to be able to care fully for what he wants and what he needs. So we were equipped with training for G-tube care, stoma care, basic everyday baby things of how to wash safely in a tub with a slippery infant. Checked up as soon as we got home from coastal health nurses that would come in and double check that we knew how to clean everything that was all the tubes and equipment. But we felt like we had an excellent round of education before we left.
I wanted to actually ask another question to you both, Leilani and Dave. You mentioned about being given a set of tools to help keep your son healthy. And I wonder if you could be specific on what some of those tools were. You've alluded to some of them, the sort of daily bits and pieces, but what do you think, if you had to pick maybe the top two, do you think?
I honestly think that the tools that we've been given are education. It's obviously something that, we were first-time parents with Theo, and we knew nothing about kidney disease. So I think one of the most important things was that we just learned everything we could about kidney disease and what its impacts were. And from there, of course, the tools themselves were just, learning how to deal with the medications that we'd never expected. We were taught how to do that. We were taught what to look out for if there were things that we should, consider contacting a doctor for. And it really helped because I know, at least for me, as I never had a kid before, is this kidney related or is this just what babies do? So I think that would be the big one.
On that note of information, then maybe I can take that one step further and again open this up to all the panel members. I often start by giving people basic counseling. You know, you don't want to overwhelm. Refer on to some references, maybe some websites, some stuff on the Renal Agency website, the Kidney Foundation website, and then we refer on to our CKD programs. I think a large part of the process is educating primary care as well and knowing what role they have and how they can kind of interplay with the care that we provide. But I'm wondering, is it preferred? I assume all of these things are helpful, sort of the graded approach to the knowledge provision. Is there one particular area that you found helpful, a website or speaking to a particular nurse or the day of the diagnosis? What do you think? Sort of all of the above? The learning, was there a specific learning person or tool, or was it really all of the above? What was the best learning resource for you about your disease?
That's hard to say. You know, my wife, with her experience, like I said, I was lucky that I met her, and that's been significant, very significant advantage for me. As well, I've been able to understand the implications of the illness and the treatment and that kind of thing. So, you know, my doctor, my nurses at the home dialysis unit were very helpful that way. It's just a matter of, you know, you really need to be well informed. To take all the sources that you can get to give you you need to be confident in your ability to discuss your own health with your healthcare team. And over the years I've seen it's not a good idea to just let people decide what they're going to do for you.
Yeah, so personal. You've got to have a say in this. Yeah, absolutely. Perfect. We've got someone at the microphone.
I'm not sure if this is working, though. I don't. Is it? Oh my gosh, yes, it is. Sorry. Okay, Mr. Kerr, I applaud you for the 44 years. My comment is, I'm a hemodialysis nurse, and I know there is push to get our patients to be more independent, do the home therapy. A lot of the patients that we get are older, and I look at taking the care home to be such a burden, and I sometimes feel like we're transferring the burden of care to them at home, because in your fortunate situation, if I can say, the fact that your wife was a dialysis nurse is huge. You get some of our older couples, and that is a lot of work. It's a lot of responsibility. So how do you, it's difficult to get them to go home.
I'll just restate the question for Mr. Shaw with some hearing issues. This was a hemodialysis nurse, and she was acknowledging, particularly for some of our older patients who we are promoting home therapies, that it's a challenge to provide the information and to have them accept the treatment. And she acknowledged the relatively fortunate position you're in with your wife's expertise. So if you could imagine not having your wife's expertise, what insights that you might have for someone who starts off dialysis older in life, and for us to have them transition to home.
Right, yeah. I guess the most important thing is, and I know it's difficult, and as far as you said, the burden of it, we feel that now a lot, because at the time when it's 10 o'clock at night and people are getting relaxed and everybody else getting ready to go to bed, we're getting up, setting the machine up, and I'm getting on the machine. So that's a significant burden for nocturnal patients, or home dialysis patients at all, I suppose, because I used to do that at 5 o'clock, and then we're trying to get on and get off and go to bed and get back up for work the next day. But the benefits of nocturnal hemodialysis in particular are so significant that it's hard to imagine until you do it. You can tell people, you know, how good it is, but been able to do things that I'm pretty sure a lot of people aren't doing. Skiing, travel, you know, I played hockey, my work league, and work out in the gym and all that kind of thing. I mean, there's so many benefits. And I think that's the thing you need to stress with your patients is that, yes, it is a burden. I'm not going to deny that. There's a lot of work involved, and it gets frustrating to do that, but the health benefits are enormous. And I think if you can stress that with them, you can really get them to understand how beneficial it will be. That might be the key. I know I had my mom and dad, and my mom and dad had each other, and now I have Julie, and so yeah, I've been enormously lucky as far as that goes, and there hasn't been a signal amount of stress on one person per se. So difficult for me to speak to that, but like I said, the benefits are enormous. So.
And we have another person at the microphone. Please go ahead.
Yeah, thank you. I'm a social worker. My name is Sarb. I was wondering, first of all, I want to thank all of you for sharing your heartfelt stories. It was very moving. What I'm curious to know is, oftentimes as a team, certain things get overlooked. And for example, I'm wondering, what were your experiences on the aspect of finances? For example, some people aren't able to work, or as you had mentioned before about your insurance issues, and how that may have impacted you as both as individuals and as a family. So sometimes as a team, that piece kind of gets overlooked about the financial distresses that patients and families experience. Thank you.
I guess I can say that, yeah, we did it. It was a team effort. I think we were lucky because we did have help in all aspects of taking care of Theo when he was first born. I don't think a lot got dropped or fell through the cracks. I distinctly recall, for instance, a social worker coming up and specifically saying, well, you're going to need to this, this, and this. We had, we wrote letters. They had to get, through a variety of people, and it was always done. I think the only thing that maybe fell through the cracks is that sometimes we didn't know what questions to ask. So.
Well, in my case, as you can see, that my issue is like with my complex case, health was a problem for me because before my dialysis started or commenced, I was able to do some things with little help, but then once dialysis started, I then needed almost like a full-time person to help me in and out of bed, out of doing my personal hygienes and that stuff, and getting into my chair. And the problem too was my transportation going for my dialysis, because you have to be up, well, unlike many persons, I guess it would take you half an hour, 25 minutes to prepare, jump out and get going. For me, it takes me an hour and 45 minutes to get ready before I could get from a dialysis. The worst part, worsened by the bus, when they come, Handicard comes, they only give you 3 minutes from the time they arrive at your door to get on board, and then be on time for your treatment, where most of the times we're always late anyway with Handicard. But that's my that's the problem. We had, or like I said earlier, because things happen so fast that we didn't have much time to consult our social workers. In fact, I didn't know which social worker to talk to earlier, because I was talking to one of our social workers upstairs first at the start of my education, and things happened so fast. I had to be transferred to our renal department, and of course there's different social workers out there again. So there was no map for us or for me. The other thing that kind of made it difficult for me was I had a few crashes when I was doing my dialysis. I was unprepared for it. Several of them, it was on places where I could not get any help. 911, I love 911 because some people were able to get them there, but those instances, it's hard if you don't have a map to start with, and it's hard when you don't have anybody that you could talk to in person. It's like sometimes the phone. One time I called in for help, and my cell battery unfortunately died in between. So it was kind of hard with all these technologies that we have. That was my problem.
We have time for one more question, so I'm going to be selfish at the end here and ask this last question, and maybe just ask if all our panelists can take this question in turn, and just come up with your top one. There's an important question that was sent in here, and Ben, you had spoken to denial. Your initial reaction to your condition was to deny it, and if you could think of your top one thing, maybe it was time. But was it something that someone in the healthcare team did, or in your family to help you get over the denial?
I have a very close-knit family, and I come from a big clan. And of course, I was also a person on the go. I was always involved with, with my community, some form of advocacy or something like that. So, my family helped me a lot. I live with 5 nurses, fortunately. So I had a medical input in there. And then from where I usually use my time for advocacy is I go to GF Strong, Pearson, Holy Family, places where there are isolated seniors and people with disabilities. Because like I was really heavy in making sure that their transportation for their medical appointments and other things are heard by the people that makes decision at TransLink.
Yeah, I guess not so much about the denial part, because we were pretty aware as we went through about what was the potential for everything, but just to the main source of help. I mean, I was a stay-at-home father for the first 2 years of Theo's life, and obviously Lanny was there for weekends and after work, and I have a close family, and all that helped. But just having one person at nephrology that was designated like a point person, and it happened to be Marg at nephrology at Children's, and just quickly replying to emails, questions that I had. If she didn't know the answer, it was farmed out to the correct people, pharmacist or dietitian or doctor, and just knowing that support was there quickly with an email was huge.
I think that's a super important tip, because that must bring up the patient anxiety factor hugely. Thank you. I think that's a point we all need to hear. And maybe we can work on a system collectively. Okay, and Mr. Shaw, any final thoughts about if denial was a factor for you and how you got through any denial of your process? Or
What do you mean? How do you mean denial?
Well, perhaps early on when you were first diagnosed and coming to live with your condition, and then you mentioned your parents were really helpful in engaging, later your wife, but if you had to pick the top one thing, let's say, to help you deal with your disease, healthcare professional, family, otherwise?
Well, at the beginning, I used to have I was very active in sports and that sort of thing, and I had to stop all of that, some of which I'm still dealing with now. But so I had a lot of why me kind of questions, and I struggled with that quite a bit. And so my father was the guy that kind of got me over that, because he sort of said, well, you can't ask this question because there's no answer to it. So you just have to stop asking the question and deal with it as it comes. Now, You know, my wife, Julie, says, you just have to go one day at a time. I know it's very cliche, but yeah, you know, I had to just kind of say, okay, well, this is what it is now. And I think the competitiveness that I had in sports helped me get through it, because I just wasn't going to let it get the better of me. So,
So it's a healthy distraction, quite literally.
yeah, that's
Yeah, oh, that's great.
went forward and, you know, dealt with it. That's the only way I knew how to do it. So.
It's kind of good advice for all of us, hey, and other spheres of life too. We've run out of time. I could sit here all day and think of a million more things to ask. Thanks to the audience for coming up with some helpful questions as well. And I just want to end on the note, Bet, you mentioned that humanity, the word humanity came up in your talk. And this is something I think of, you know, every day in what we do. It has to have meaning. And I think I'm like everyone else here in the room, that we try to be dedicated, and ultimately that's what it's about. So hearing from everybody at this level and feeding back to us, I think has been tremendously helpful for the community. So once again, thank you all.